officially kicked off at the premier event for otolaryngology administrators, the AOA 36 Annual Educational Conference.
The AOA Annual Education Conference has always been known as the place where you can come and get the next big idea.
As the sounding board for physicians, otolaryngology administrators combine their passion for medicine and people into their day-to-day to keep the practice effective, profitable, and sustainable. Keynote speaker Jason Hewlett delivered an engaging presentation that encouraged leaders to identify their signature move, find their voice, and magnify what makes them a legend at what they do.
The ENT profession, I don't think, realizes the impact they have on so many people that actually utilize their voice for a living across the entire spectrum. ENT is an amazing practice. It's an amazing art form. And if we discover what makes us unique enough to give others the opportunity to go and spread the word with what they do, with what they're great at, these guys are already implementing the promise right now.
From the opening ceremony stage to concurrent sessions like this one, there is no topic off the table, including healthcare reform. In this session with speaker Ron Howrigan, ENT practice managers learned how healthcare could kill the U.S. economy and what they can do to stop it.
Be part of the solution. So understand that what we've done in the past and what these practice managers and their physicians have done is provide incredible care. We provide incredible access and incredible quality. Now what they need to do is start adding economics to that. Starting to say, look, we know that this is expensive. This drug is less expensive, it's almost as good. Or why don't you try to do this procedure versus that? Or we can do this in a different setting and save money. They've got to start to add economics into the decision making and make sure that they can help their patients down that road.
I think we really need to look at that and make sure what we are doing is of value.
Next door, another important topic of conversation was on the forefront, defending E&M services.
Medical necessity drives everything that their physicians do. And because the payers put such an emphasis onto that, and that's really what their key focus is in making determinations as to whether they're going to pay for a claim or they're going to deny a claim, the practices and their physicians need to put that same amount of energy and emphasis into the upfront work that they're doing to establish medical necessity.
This conference serves as the perfect platform to share industry updates. AOA is excited to partner with the American Academy of Otolaryngology Head and Neck Surgery in an effort to provide ENT practice managers more resources and an expanded community.
I encourage all of our members to really tap into the communities that we have. Now we have defined formal communities that really touch on every size practice. And for people to reach into that, to use our technology tools, but to call when they've got a problem, it's amazing. It's really what's going to set them apart as a manager going forward.
As we continue our week of education and networking in New Orleans, we encourage you to share your experience with us on social media using the official conference hashtag AOA36. That does it for us on AOA TV as we wrap up Wednesday's events, but not before some sights and sounds from the Second Line Parade.